Some of the ways to avoid a joint replacement surgery involve staying healthy, active, and fit, and trying to lead as active a lifestyle as you can. Other ways involve visiting your doctor and talking to him or her about different strategies short of a knee replacement that will give you the knee relief that you're looking for. In the sports medicine world, and in my practice in particular, we have a big focus on preserving the joint or trying to keep you out of the operating room with regard to a joint replacement surgery. In some cases, we can offer physical therapy or other non-operative modalities to help you get back in the game without an operation. In other cases, if physical therapy does not seem to help, we can offer things such as orthobiologics or injections that can help mediate your symptoms, improve your pain, reduce your inflammation, and improve your function and keep you out of the operating room. And then in other cases, we do have to perform an operation, but it's a minimally invasive advanced technique with regard to doing an arthroscopy or doing a cartilage transplant, a meniscus transplant, or in some cases a realignment osteotomy where we take the arthritis that's affecting one part of your knee and really make it so that your knee doesn't feel the effect of that arthritis by realigning the anatomy of your joint. But certainly we can keep you out of the operating room with regard to knee replacement in many cases.